Welcome to the Healthy Skin Show with Jennifer Fugo, where we're flipping everything you've been told about your chronic skin issues upside down and connecting you with alternative solutions your dermatologist never told you about.
Welcome back to episode number 292 of the Healthy Skin Show. In today's episode, we are going to dive into a personal journey all about progesterone hypersensitivity. As you may recall, I talked about what is currently known about progesterone hypersensitivity, also sometimes referred to online as autoimmune progesterone dermatitis, in episode 250. But there is more to this story than, unfortunately, what is barely written about, to be honest with you, online. That's one reason why this condition is considered rare. I think partly because it's not diagnosed frequently, but I also wonder if part of the reason that is because it's not well known. So it's not something that is normally considered unless the patient typically picks up on some sort of pattern that might indicate an issue with their progesterone. And the quick answer to what exactly is progesterone hypersensitivity, if you missed episode 250, is that you essentially become allergic to your body's progesterone. And if that isn't a sort of scary concept that you could become sensitive, hyperreactive, allergic to a hormone that your body produces, especially for women, on a monthly basis, I don't know what is, because this is a very tricky condition to address. And my guest today has actually gone through this. Not only did she stumble across a way to help her body reduce its reactivity, but she's also an integrative nurse practitioner. So she's got this really interesting perspective on different sides of this puzzle. And I'm so grateful to have her joining us here today to share her story and what helped her on her journey. My guest, whom I became connected with through Instagram, believe it or not, is Sarah Tyler. She's an integrative nurse practitioner who received her Bachelor of Science in Nursing from the University of Alabama in Birmingham, her Master's of Science in Nursing from Vanderbilt University with an emphasis in family medicine, and is certified by the American Academy of Nurse Practitioners. She is passionate about nursing because its foundation is rooted in holistic health theories that recognize the importance of considering the whole individual and convey the interconnectedness of one's physical, psychological, environmental, and spiritual contributions to your overall health. And Sarah currently practices in Denver, Colorado. So without further ado, let's dive into today's conversation. Hi, Sarah. Thank you so much for joining me today.
Hello. Thank you for having me. Happy to be here.
Yeah, and I'm excited to have you here because we connected many months ago. You had actually seen a post on my Instagram where I was talking about progesterone hypersensitivity, and you wrote me and you're like, oh my goodness, I had this, have had. We'll go into that.
Nice.
And you're one of the first people that is more obviously on the practitioner side of things that I know of who's actually lived with this and dealt with it, and actually found some ways to help support your body around this to become less reactive. So I'm so glad that you could be here today. And I figured, even though I did do a bit of I would say like a cursory review of like what progesterone hypersensitivity is, do you want to just define that for the listeners in case this is the first time they're hearing about what like an actual reaction to progesterone?
Sure. And so the term progesterone hypersensitivity is similar to the original term, which was autoimmune progesterone dermatitis. And so what that is your innate immune system reacting in various ways. As far as my situation, it was in my skin and through a rash to levels of progesterone. And so essentially it's an allergy to your own progesterone.
And that, when you think about it, is like kind of horrifying because it's a
Yeah,
hormone our body makes.
right. And it's also necessary to conceive, and it's also necessary, to feel calm as a woman. It's a calming hormone. And a lot of the time with the hypersensitivity, you end up having lower levels of progesterone or difficulty with ovulation. So that's sort of a piece of the puzzle as well. So you'll present with not only a luteal phase rash, so luteal phase of your cycle, whenever post ovulation, when your progesterone levels should be rising, that the rash will fade when you start your period and those hormone levels drop. But you can also have irregular cycles, infertility, etc.
This episode is brought to you by my line of professional grade supplements called NutriQuel. I crafted these supplements especially for those struggling with chronic skin rash issues and base the formulations on my extensive research and clinical experience in my private practice. They are made from the highest quality ingredients and tested to be free of different allergens so that you can support your gut, liver, and overall health with the formulas that I've found work best for my Skin Rash Warrior clients without triggering a flare. I'm excited to share them with you, so check them out at quellshop.com and use the coupon code GET15OFF to get 15% off your first order. I'll put a link in the description below. And now let's jump back to the video. Yeah, and so you've dealt with this personally. Do you want to share briefly what your experience has been living with this?
Sure. The issue presented for me when during my first pregnancy, it was my second trimester of pregnancy, and it presented as a extremely itchy, angry, papular, bumpy rash that was only on my abdomen at the time. So every provider, every dermatologist, every fetal maternal specialist, my midwife, everyone said, "Oh, this is PUPS," which is a itchy rash that you can get during pregnancy, but then post-pregnancy, it should disappear. And so I had my heart set on it disappearing when I had my son, and it is more common in your first child and if they're a boy. So I had all of those things. So they're like, "Yeah, this is pregnancy rash. It's going to go away. No big deal." Meanwhile, I was like coating myself in zinc oxide, just any sort of thing I could put as a skin barrier. And so like I ruined all of those maternity clothes because I was constantly like covered in ointment. So anyway, I had my son, very healthy pregnancy, healthy natural delivery, and following delivery, I would say the rash faded initially and then it exploded. My whole body from head to toe was covered, and it almost looked like, it was blisters, it was raw, it was bumps, itching, burning, stabbing. It was worse at night. I was already up breastfeeding, but then I was in a pretty excruciating discomfort for a really long time. And I had the rash for 2.5 years, and it took me a really long time to figure out what it was and connect it to my progesterone because I'd always had irregular cycles.
How did you connect? What dots did you connect, or did you find somebody to help you figure that out, or what happened?
So initially, it was a bit of like, survival mode. I had gone to an urgent care, a provider that I didn't know. He had done a biopsy. I went to the University of Colorado. They did several biopsies. Everything was coming up as either eczema or spongiatic dermatitis, which is very nonspecific and vague. And so I was given, instructions I was doing steroid tapers just to survive, essentially. I also simultaneously had really elevated liver enzymes and really high inflammatory markers like C-reactive protein. So I was just like a giant fireball of inflammation. I didn't have a cycle because I was breastfeeding for 6 months. And during that time, I wanted to I was using more traditional means because I didn't know as far as, using alternatives while breastfeeding. I wasn't sure about that. So, I mean, the traditional sort of treatments are not awesome. So, like the oral steroids for 2 months, I did bleach baths. I was instructed to cover my body in Vaseline. Um, not very therapeutic at all.
No.
So once I stopped breastfeeding, I became more interested in doing like all of the things that I would normally do for my health. And I tapped into a Eastern Chinese medicine doctor. I was doing acupuncture, custom Chinese herbs. I did a rid, repair, restore gut protocol to sort of cover for any bad bacteria, yeast overgrowth, parasites, leaky gut, you name it. I did doxepin through the dermatologist, which is a traditional treatment. It's an antihistamine. And also they were like, you need it also has antidepressant properties. They're like, you need an antidepressant because you've got to be depressed to have this rash. I did Whole30 for an entire year and didn't really see much improvement there. And the rash was morphing the whole time. It would flare and come and go. And I think it was in the summer of 2019. It was either spring or summer. I'd also been to an immunologist and been tested for every allergy test that they had available. Nothing came up abnormal. I looked like the pillar of health. My liver enzymes had returned to normal. My CRP was down. And so nobody could really figure it out. Because I'm an integrative provider, serendipitously, we had just brought on a physician that was a sort of old school allergist immunologist that did an alternative therapy called low dose allergen therapy, where you inject very small homeopathic level antigens from foods, chemicals, and inhalants. That's paired with an enzyme called beta-glucuronidase that causes these antigens that are very low levels to sort of recirculate over and over again in your system, which raises T regulator cells. And those guys like put the brakes on your overactive immune system. I had zero hope that this was going to help me at all because I didn't know that I had an allergy. It's good for seasonal allergic rhinitis, cat, dander, dog, just good old regular allergies. And so I had no hope that I was going to do this. It is out of pocket. It's expensive. It's not covered by insurance, of course. I told myself, I'd spoken to the doctor that sort of brought LDA to the U.S., Butch Schrader, because I had this connection with this physician that worked at my office who was bringing this therapy to Sound Clinic. And he had emailed Dr. Schrader and to ask, because at the time I had sort of realized that this rash presented mainly during my luteal phase. And because my cycles were irregular, I had to give myself herbs to promote ovulation, promote my own progesterone. But every time I tried to regulate my cycle, I would get this rash. And so Dr. Schrader said, yes, I've seen this before. People are allergic to their allergies. This will work. I was like, okay. So I did 2 injections. You do them 2 months apart. You have to do several lifestyle changes simultaneously. You essentially have to, for 3 days, sort of be in a bubble because during those critical days, if you come into contact with things, you could become sensitive to them. So you could develop allergies if you have them during those 3 critical days around when you get the injection. So anyway, I did 2 of those injections. You have to pair it with steroids. You have to do an antifungal treatment prior. It's very involved. That's why I don't recommend it unless it's like last resort kind of thing. And so my rash flared head to toe the first injection I got. It was just went nuts. And I was like, well, that's something. And then in 2 weeks, it was gone. And so I was like, should I do another one? And so I was recommended to do another one. The same thing happened, head to toe sort of flare. And then my rash pretty much faded out from there, which that was 2.5 years later from when it started. And so in that interim, I'd had a miscarriage and a chemical pregnancy, again, because of that progesterone hypersensitivity. That's a lot of times common. And I had sort of the pandemic hit. So I kind of stopped trying to prioritize getting pregnant again. And then things sort of were settling down. So I ended up going to, I put myself on luteal phase progesterone because I was connecting the dots as far as thinking that that's why I could have miscarried. And so I went to CCRM because I knew I had an issue with ovulation. So I was just going to go ahead and get some good old Clomid and try to get some ovulation rolling. And I did a test. The first test that they do is they make sure that your fallopian tubes are patent, and mine were both blocked. So they're like, okay, you're not a candidate for anything but IVF. It's like, oh, okay. So in my integrative background, I sort of researched blocked tubes, which I'm guessing just from an inflammatory standpoint of my progesterone hypersensitivity, I guess that's what had sort of led to that. I did castor oil, some Chinese herbs, some serapeptase, which is a biofilm buster, along with my herbs to help me ovulate, and luteal phase progesterone, and had a very healthy pregnancy, and now have a 5-month-old.
Oh,
So
and do you
that's
get
kind of where I am now.
Yeah, and I'm sure everybody's wondering, like, do you still get the rash every month when well, I don't know if you're back to a normal cycle at this point, but how did you do during pregnancy? I mean, obviously that's a place when progesterone is up, and how did that turn out for you?
So what's interesting, I was terrified the entire time because I knew that, your progesterone is soaring during pregnancy, and it's part of the reasons why it's sustained. But when you dive into progesterone hypersensitivity forums, a lot of people's experience is that you'll have a lot of flares during the first trimester, until that placental progesterone levels start increasing. And then once that happens, I don't know if immune system shift takes place, but the rash fades. And currently I'm breastfeeding, and for some people, the rash does return when your cycles return after you breastfeed. So I'm crossing my fingers, and I do feel hopeful now that I know what it is and how to address it. I didn't mention, prior to doing the LDA, the alternative therapy for allergies, I did 90 days of Benadryl, which zapped my brain completely, but it made my rash go away. So there's definitely a histamine component, and a true allergy would sort of respond to Benadryl in the same way. And so now I have all these clues. I also have, I think that my predisposition was a lot of stress, and definitely the gut was a piece of the puzzle. I had, prior to becoming pregnant, I had been dealing with chronic constipation for a really long time. And so I don't really know what sort of magic recipe led to the progesterone hypersensitivity developing, but my stress levels dropped significantly, actually during the pandemic. And so a lot of sort of things changed with my personal life, and my stress went from about a 12 to about a 2. And I think that allowed me to get pregnant, and I think that that's going to allow me also to not have so much immune system dysregulation.
Yeah. So let's talk a little bit about, for women listening to this and maybe they're unsure, they're going, wait, some of this sounds familiar, right? In my research, what I had uncovered was that something in regards to birth control pills. I have one client who has had this, and they had actually tried birth control pills, and she seemed more reactive to that. But there's some potential tie to birth control pills, some potential tie to IVF that I've read about. Any thoughts on these sort of like unnatural, or synthetic versions of hormones? Like, does that possibly play a role, do you think?
It does seem so. It seems that, like a lot of these sort of mysterious conditions, every single individual is different. What's unique, or what seems to be widespread, is that there was some exogenous synthetic hormone at some point in every woman's life that has developed this condition. So for me, in my 20s, when I tried birth control, I like gained 25 pounds and became severely depressed, couldn't get out of bed. So I hadn't been on birth control my entire life because of that. So that was sort of the only thing. But then I had this pregnancy that sort of triggered it all. And so it's hard to know. A lot of times people are also in the traditional world treated with synthetic birth control when they have the condition. And sometimes it helps because you're suppressing your own endogenous ovulation and progesterone levels.
It is wild. It is wild that it's kind of like what may not work for one person might work for someone else. And that's what makes this a very unique process. Fortunately, unfortunately.
It takes some sleuthing. But one really positive thing is there's a physician that's now doing the testing. So if any of you are developing rashes during that second half of your cycle, when your progesterone levels are present, post-ovulation, you can now get a blood test for it. And I will drop his name. It's Dr. Jonathan Bernstein. He's out of Cleveland, Ohio. And I think the test runs around $200, and you need a doctor's order or provider's order for that. So a lot of women are getting answers. And I think once you know that that's going on, then you can pull in your tools. And because when you're like thinking, is it the piece of bread I just ate? Is it, something else? Like there's so many variables in the environment to try to pinpoint. And so to have that answer, there are a lot of different options for people. When I first started researching it, I remember some women anaphylax during their luteal phase. So it can present as a rash, and it can get as extreme as anaphylaxis.
Oh my.
So the first articles, and there's like 3 or 4 articles available. I also this reminds me, one of them is a case study, and it went through like different progesterone desensitizations, which I actually did that prior to the LDA, and it didn't help me. I did oral progesterone. I titrated it up. It didn't help at all. But that's not to say that it couldn't help with someone else. And that's one of the theories why they think that it fades in pregnancy, is because your progesterone is gradually increasing over time. I personally don't think that's the case. I think it's an immune system shift, and sort of our more dominant immune system becomes a little less active so that we're not reacting to the baby. That's my personal theory.
And can I ask you, does this sort of underscore the need? And I think tracking can be very helpful, but I feel like for women who are cycling, or even if you have an irregular cycle, like what would you recommend for them to figure out if this is a luteal phase problem?
So I think apps are really helpful if you're tracking your period, because you can track symptoms along with that. And I wasn't using an app at the time, but because my cycles were so irregular, and every time I would try to get my body to ovulate, then I would have the rash. It was easy for me to put it together. But a lot of women that have regular cycles also have this condition. And so I am old school. I like printing out a calendar. And so if you're having a rash, 2 weeks out of the calendar, then that's a big clue that you could be reacting to a hormone. People also react to estrogen. So estrogen's present during the whole cycle. So that's like a whole nother ball of wax. But progesterone piece, is a little more predictable because it is the second half of your cycle post ovulation.
And if you believe that you have this, and I know that you have a clinic, and we'll put all of your links to it's soundclinic.com. Yes.
Mhm.
Yeah. So people can contact you through there because obviously you do work with people. But they're going to track. And then what's the best next step? If you really do believe that you have this issue, like, do you think it's worthwhile to get some sort of testing done to determine progesterone as the specific problem? Or could you possibly just proceed forward with like, oh, this is when it flares consistently. I've tracked for 6 months. This happens.
Yeah. So, as someone who sort of practices functional medicine, I always would, as part of the treatment protocol or plan, sort of focus on those foundational pieces of health. So that would be, optimizing sleep, lowering stress, sort of evaluating their nutrition to make sure that they're eating, a wide variety of whole foods, moving their body. I can think of physical activity. And then that spiritual component that can sort of get squelched in our culture sometime. And I think of the spiritual component as something that's really broad, like, either being creativity, connecting with other humans, spending time in nature, having some sort of ritual. So I would incorporate I think it would be important to incorporate those foundational pieces of health in addition to going ahead and, trying to suppress the reaction. And so just doing a trial of it based on the person's preference. I mean, what I did prior to moving from Benadryl, now when I ever have any sort of itchiness, I use natural antihistamines. And so I think, putting together a little gut health support, gut healing protocol, trying some antihistamines, focusing on those foundational things. And I think if it is a hypersensitivity progesterone happening, you're going to respond to antihistamines. And which is really
Interesting. Good. So that would be another potential thing to try then, because I know a lot of people are like, I don't want to do this. It's a medicine, but like we can all get access to like Benadryl over the counter and these other.
3 like very accessible antihistamines that are traditional over the counter would be Benadryl, Pepcid, which is an H blocker, so it has an antihistamine property, and Zyrtec. So if you did a trial with that during, for 2 to 3 months, and your symptoms would probably go away, then that would be another clue that you're dealing with this. Because I wasn't sure if from an autoimmune standpoint, I was always confused because autoimmune conditions typically don't respond to antihistamines. But I think that's why they renamed it. They renamed it progesterone hypersensitivity because the autoimmune, it was named that because we're reacting to something inside our body. But it's essentially a true allergy, an IgE-mediated allergy.
Yeah. And I wanted to also clarify, you had mentioned something before we started talking. Most people are thinking eczema rash, but you had another patient recently that they had some other type of rash going on. So what type of rashes could show up during this luteal phase?
Well, even on my own body, depending on where the rash was, it was very different on my arm than it was on my leg. On my leg, I had these papules that were extremely painful, and they would scab and not heal, and they would bleed. It was the strangest thing. And then on my arm, I would have it was very spongiotic, just inflamed eczema presentation. On my fingers, I would have dyshydrotic eczema. And so, and then a patient that I saw recently that was having a rash during her luteal phase, she has classic urticaria, which is hives, that moves around your body, welt presentation. And so it really just depends. And like I said, you can have rashes. Some people even have anaphylaxis, which is really scary.
Yeah. Oh my goodness. I mean, I will say that while I'm sure being in this was not fun. And you were probably like, why? Please. But I am grateful that you were willing to come here and share your experience, because there's just such little information, and it's claimed that this is rare. But I do wonder if it's rare because no one really looks for it.
Absolutely. And that was the frustration when I sought out care at a university research institution. As I was like, can you please somehow test me for because I was very suspicious. And again, it was just kind of like the Band-Aid of here's some steroids, just here's some Vaseline, take some bleach bath so you don't get staph. Goodbye, yeah. So, but I do laugh about it now, and it wasn't a laughable situation at all. It was extremely painful. It was extremely stressful. It was traumatic in a way, just having to deal with being a medical provider, having this mysterious rash, dealing with traditional and alternate, doing all the things, and it taking a really long time for me to understand what was going on and how to deal with it.
Well, I just want to thank you so much for being here today. I really appreciate it. And also, as I mentioned initially in the intro, you are a practitioner. So if people, do they need to be to live in your state, or can you work with people outside of Colorado?
So yeah, I do telemedicine primarily now. My office is located in Denver, Colorado, but I live in the mountains in Telluride, Colorado. So most of my appointments are virtually. So I do see people out of state. We do accept insurance, which is unique to our practice. And so that sort of, I think, sometimes that prevents people from out of state, depending on their insurance, from being able to come to our practice. But I do see a lot of out of state.
Okay.
So you're welcome to reach out. We have a website, soundclinic.com, and you'll be able to see my bio and the other practitioners. We have a really awesome, unique clinic.
Awesome. Well, thank you so much, Sarah. I appreciate
Thank
your
you for
time.
having
And
me,
yeah, and
sharing
it's
these
just
stories.
it is so important that we share our stories, right? Because unless there's unfortunately a medication to solve this, there's not a lot of research being put into this area.
Exactly. I will say, I don't want to plug Facebook or anything, but in this whole journey, there's several Facebook groups that I've sort of tapped into related to just being a provider. There's a mast cell activation is a condition that's linked a lot of the time with progesterone hypersensitivity and sometimes gets confused. So there's both a mast cell activation Facebook group and there's a progesterone hypersensitivity Facebook. So that is a good resource, because then you can you see all the different, sometimes it creates more anxiety, but a lot of times I just think take it with a grain of salt and use it as far as a collection of information, what people are using as treatments, what's been helpful, what hasn't been helpful. And also just, to be supportive, because it's a hard thing to live through.
It is. It is. Well, thank you so much for being here. And
Thanks
who
for
knows,
having me.
you may be back as you find more things to share with us. But it's so great to have you. And thank you so much for the time.
Thanks so much, Jennifer.
For those of you who are dealing with progesterone hypersensitivity, or you suspect that you are, my heart goes out to you, because this is a really tricky situation. There is really, truly no best way forward, unfortunately. It's something that even from an integrative perspective doesn't have a lot of options. That's one reason why I wanted to share Sarah's story. And if you'd love to check out the resources I've linked up for you about this episode and progesterone hypersensitivity, and maybe you have questions or comments, you can head on over to skinterrupt.com/292 and leave your thoughts there so we can keep the conversation going. And because of how little information there is on progesterone hypersensitivity, if you're in some sort of Facebook group or forum or something, or you just know somebody who possibly is dealing with this, please make a point to share this episode with them, because perhaps this may be an appropriate course of treatment for them that could bring possible relief. And if you haven't done so yet, please make a point to rate and review the Healthy Skin Show, then hit that subscribe button. That way you never miss a weekly dose of personal journeys like this one, new research, inspiration, and clinical tips and strategies to help you on your journey to rebuilding healthy skin. And then let's connect over on Instagram. I'm at Jennifer Fugo. Thanks so much for tuning in, and I look forward to diving deeper with you in the next episode.